Hi, I'm new. Virus. Why? Good morning. Why will your name be Virus? Is that your real name or that's your nickname? Good morning. Hi, how you doing? And how is your day going? Now it's early morning here in Nigeria, 8 a.m. and it's raining. The weather is raining. So where are you streaming from and how are you doing? How is your day going? Is that English? I am Sup. Hi, I'm new Jared. I don't really understand. Is it English you're typing? I don't get you. Hope you're fine. So it was raining this morning, but everywhere now is so calm. So calm. I have to restart my life because network was disturbing me. I have to start the life afresh again. So I put a question. If you check very well my channel, there's a question I asked. I like your shouts. This is actually a gown, not a shirt. Thank you so much. Thank you. But this is a gown, a handless gown. It has a jacket, but there's no need of wearing the jacket now because I'm not going out. It has a long jacket that I can just put in some now. But since I'm not going out, there's no need of putting on the jacket. So, how is your day going? Thank you so much. This is an Ankara material. I don't know if you really understand what that means. I'm not really good with material, so I don't know their names. So just designed by my tailor. So I was asking a question, an interesting question. Is ending a pregnancy that is not compatible with life, or maybe that has a severe fetal abnormalities considered as an abortion? Because this debate, some people say it's not. Why some persons they say yes, it's an abortion. As long as it involves ending of life, it's considered as an abortion. Why some persons they say it's not because it has fetal abnormalities. All these abnormalities that when you go to the scan or go to the hospital, they check and see that maybe the baby the if maybe there's a missing organ, something like Down syndrome, or maybe those kind of abnormalities that once you give birth to the child, it might not even survive. So some person might be asking, is it considered as an abortion? Because we came from different backgrounds where we believe different things. Some persons here are Muslims, some are Christians, some are Hindus, where abortion is not condoned. You understand? We are the frown at it. So now, like the question I asked, is ending a pregnancy that has all these abnormalities considered as an abortion? Well, from a medical perspective, an abortion is when you intentionally end a pregnancy, when the baby is not born yet, when the baby cannot survive independently outside the womb. But you need to understand that there are different type of abortion. We have elective abortion, medical or therapeutic abortion. Now, in elective abortion is when an individual decides to end the pregnancy based on personal reasons known to them. Can decide to end the pregnancy based on personal reasons. The reason can be finance. The reason can be if maybe you're not well prepared enough to be a mom or a dad, because not everyone that is prepared to be a parent, you understand? So for personal reasons, you just decide to end the pregnancy. That is what we call elective abortion. Now, for medical or therapeutic abortion is when you go for maybe an ultrasound test and a doctor discover that this pregnancy may put you at risk as a mom. Maybe your health might be at risk as a mom, or maybe this pregnancy is associated with profound suffering for the baby if the baby is born, or maybe the baby, even if the baby is born, the baby might not survive, might eventually die, or maybe there are different kinds of abnormalities that that will put that child at severe suffering, that you need to be in and out of the hospital, that child may need profound 24 hours care. Now you may ask yourself, if terminating such kind of pregnancy considered as an abortion? Yes, it is. But just that there is different is the same definition but different circumstances. Ending a pregnancy intentionally is considered as an abortion, but abortion is not really that. I won't say it's bad, I won't say it's good, depending on your belief. You understand? Depending on your belief. If a doctor sees a pregnancy that is not compatible with life and advise you to end it, for me, I see nothing wrong in that. I see nothing wrong in that. You understand? Your sorry, let me pick this call. Hello, mommy. Good morning. Hello. I'll call you back later. Good morning. I called yesterday. I want check whether market day today. That's why I called. But I noticed that today is their market. Okay, okay. How your body day now? Sorry, let me pick this call. I'm fine. How that day? The body don't come back, Abby. Okay, now that one will be one fast now by when they eat the same blood medicine. As long as the body don't come back and that one is okay. Okay now. Take care. Think they fine, but never wake up. Okay, take care, ma. Mm. Sorry, I have to pick that call. I couldn't withhold that call, so I don't know. But those of you that are still here, so I was saying something. I don't even know where I was. So I was saying something about abortion, and people need to understand that your pastor is not your doctor. Your pastor is not your doctor. Your religious leader is not your doctor. You understand? Because some religious leader will advise you to keep it, that miracle will happen. I'm not downplaying miracle because miracle is something that is supernatural, is above human explanation, human existence. Me, myself, I'm a Christian, so I don't really look down on miracle, you understand? Because I've experienced it countless times. So I don't really look down on it. So but in such kind of case, it's good to use to apply wisdom when you know very well that this pregnancy is not compatible with life, can put your life at risk. Can as a mom, your life can be at risk. You can lose your life through the pregnancy, and if you have this baby, you are also suffering the child because imagine having a baby that cannot feed on their own, cannot work on their own, cannot do anything on their own, need support 24 hours. Imagine having a baby that maybe some of them are in life support. It's kind of a lot of it's very emotional and devastating for the parents and also for the mother. The difference between you're not aware than you are aware. I can tell you for sure that you end up blaming yourself all through your life. You end up blaming yourself all through your life if you eventually continue such kind of thing and you know very well that this thing, doctor told you this thing, this pregnancy will result to this, will result to so abnormalities. And because of maybe faith or belief or miracle and you proceed to it. So it's good to apply wisdom in such kind of situation. So for those of you doubting if maybe terminating a pregnancy due to fetal abnormalities, severe fetal abnormalities, if it's considered an abortion, yes, it is. Because medically, from medical perspective, ending a pregnancy intentionally, when the baby is unable to survive independently outside the womb, is considered as an abortion. But just that elective abortion, we have elective abortion medical or therapeutic abortion. In elective abortion is when the individual decides to end the pregnancy based on personal reasons. That reason can be finances, maybe they don't have enough money to cater for the child. That reason can be maybe the mother or the father is not ready to be parents. They can decide to end it. Or maybe the person is done just once, or maybe just want to be child free, can decide that one is personal reason. Then when it comes to medical or therapeutic abortion, is when a pregnancy ends because of maybe serious risk that is posed on the mother. Maybe the pregnancy can cost you your life or your health or severe health complications. So maybe you're asked by the doctor to terminate, or this pregnancy is associated with profound suffering for the baby. You know, when the baby is born, will go through severe suffering, or there are missing organs. Such kind of abortion is called medical or therapeutic abortion, where a pregnancy is terminated due to fetal abnormalities, severe fetal abnormalities. So it's different from elective abortion, but all the same, the definition is still the same. Terminating a pregnancy intentionally is considered as an abortion, but the circumstances are different. So I know I've answered that question. Now I want some persons also to understand that your pastor is not your doctor, your religious leader is not your doctor. Yes, you heard me. Your doctor, I think, is in the best position to advise you if maybe you should keep this pregnancy, or if this pregnancy is not sustainable with life. I know there are place for belief, there are place for miracle, and don't downplay miracle, because if maybe you have experienced one in your life, you will not say bad about it. But it's advisable for someone to apply wisdom in such kind of situation, because if eventually you give birth and you notice that that child have severe abnormalities that you are that needs 24 hours care in and out of the hospital, I can tell you for sure that you will not forgive yourself, and that baby is suffering because you yourself caused it. You are aware of it, not like you're not. You understand? There are days like our foremothers, some of them were not opportune to have technology that can detect if a pregnancy is if the pregnancy is if there's abnormalities or not. But us, we are opportune to know if a pregnancy is abnormal or not. So them themselves, they give birth like that and find out that their child may have severe kind of abnormalities. But in this day and age, there are technologies that are well established, that when you go for an ultrasound scan, they can tell you that if this child have abnormalities or not. So it's different when you are not aware, and when you are aware and you are advised to terminate it and you continue. So it's different, you understand? So any such kind of thing is kind of I know going through such kind of making such kind of decisions can be very difficult and emotional. It needs wisdom. In as much as you don't want to cause any harm to any life, but it needs wisdom. So that is why a doctor is in their best position to advise you on that than your pastor when it comes to such kind of situation. So your doctor is in the best position to advise you if a pregnancy is compatible with life, if this pregnancy should continue or not, than your pastor. So there are places for miracle. There are also places when you have to face reality. You understand? I don't downplay miracle, because there are miracle happens, but there are times you have to, decide that this have to. I don't know, sharp, but let me just stop there. So I know I've answered. I don't know if I've answered some of your questions. For those of you asking, you can ask me any question. If you are enjoying the life, just drop any question. Let me know if you're interacting. Because some persons believe that once you end a pregnancy based on fetal abnormalities, that is not considered as an abortion. Actually, it is an abortion, but there are reasons for it. Is due to circumstances. Nobody's blaming you for it, but it is an abortion. Because even in miscarriage, if maybe like now we have four types of miscarriage, sorry, we have four common types of miscarriage: threatened miscarriage, inevitable miscarriage, incomplete miscarriage, and miscarriage. Now, for instance, let me use miscarriage as an example. Now, in miscarriage, there is no sign of miscarriage, there's no bleeding, there is no cramps, there might not be no bleeding, there might not be cramps, you understand? And you have to maybe eventually find out through the other ultrasound that the baby you are carrying is not either is not developing well or has died or stopped developing. Sorry, if the baby has stopped developing or has died, or maybe you know, kind of. So I can't speak anything other than English. Mm, thank you. Now I can understand you better. Thank you. So in such kind of situation, they normally recommend either you wait for the body to naturally miscarriage, or maybe you be given a pill to help to induce miscarriage. That's to help to cause an abortion. Understand? To help to induce miscarriage so that your body, because your body is not yet aware that there is a loss. That is why there's no bleeding yet. The body is not yet aware that there's a loss. So in such kind of situation, either you wait naturally or maybe they give you medication to induce it out so that those tissues, those pregnancy tissues can come in, or maybe they surgically remove it. So all these circumstances, you understand, all these circumstances, but I won't consider that one as as an abortion, because the pregnancy was the developing embryo is already dead or maybe stopped developing. Understand? So that one is different. That one is actually different. So different circumstances, like I told you, elective abortion is when you end the pregnancy due to personal reasons. That reason can be finance. That reason can be when you are not prepared enough to be a parent, or maybe any kind of reasons. Why medical or therapeutic abortion is when a pregnancy is ended due to serious health risks that can pose to the mother, or maybe severe abnormalities, missing organs, when the baby have missing organs. Imagine if you giving birth to a baby that have maybe there's no lumps, there's no kidney, there's no heart. Very well that that baby will suffer. If eventually the baby survive, understand? So all these things are kind of emotional and difficult, but yes, it's considered as an abortion. Terminating a life intentionally, medically, is considered as an abortion. So abortion is not entirely a bad thing the way some persons perceive it to be. You understand? It's not entirely a bad thing. If a medical personnel, if maybe you have read and you are when I mean read and your perspective about life is wide open, you understand very well that abortion is not entirely a bad thing. You understand? It's not entirely the way the I'm being careful with my words, is not entirely a bad thing. The reason why I say that, there are situations where the developing embryo have severe abnormalities that is not compatible with life, that the doctor may advise you to terminate the pregnancy. That one is also considered as an abortion, right? So abortion is not entirely bad. So it's not entirely bad the way some persons profoundly to be. Yeah, abortion is this. No, I'm not supporting abortion, but it's not entirely bad in such kind of situation where a pregnancy is not compatible with life, a pregnancy has severe abnormalities, a child might, a child born in such kind of situation might have suffering, might suffer all through their life, in and out, or might have 24 hours, need 24 hours care. I don't know if you get me. So in such kind of situation, I don't consider it as an entirely bad thing. And also, again, people need to understand that a miscarriage in miscarriage, sometimes they do give drugs to induce abortion also. Like in miscarriage where the baby stop developing, or maybe the baby stop developing or died, but the body is not aware of the loss, because one of the way the body respond to it is by miscarriage, the uterus bleeding, the pregnancy tissue coming out. So in such kind of situation, so in such kind of situation, either you are asked to wait naturally for the miscarriage to happen, or medication can be given to it to induce, you understand, to induce abortion or to cause miscarriage. Or maybe they can surgically remove it, to perform a simple surgery that can surgically remove the pregnancy.